Oral Health Education Series, Module 8, Clinical Care, Part 1. I'm Dr. Brecky, and I'm here with Ready, Set, Smile to talk about clinical care in dentistry. So Module 8, Clinical Care, Parts 1 and 2 are an overview and introduction to the oral health and dental care delivery system. Materials are subject to copyright by Dr. Brecky and Ready, Set, Smile. So through this introduction to clinical care in dentistry, we'll review an introduction to dentistry itself, the dental specialties, interprofessional collaborators, members of the dental team, the provision of dental care, dental anxiety, and overall health and dental care. Dental care is provided in a unique setting, often separate from medical facilities and hospitals. This is changing. Standards for and regulations of the provision of dental care are set very, very high and must be followed by all professionals, no matter where they practice. So first, what is dentistry? Well, according to the American Dental Association in 1997, dentistry is defined as the evaluation, diagnosis, prevention, and or treatment, non-surgical, surgical, or related procedures, of diseases, disorders, and or conditions of the oral cavity, the maxillofacial area, and or the adjacent and associated structures, and their impact on the human body, provided by a dentist within the scope of his or her education, training, and experience in accordance with the ethics of the profession and applicable law. That's very wordy. What do? We focus on the teeth, the mouth, the head, and the neck. So who are the members of the dental team? Well, we'll get into that in just a moment. But first, where does dental care take place? Like I said, dental care in the U.S. has historically been provided in a private clinic setting, or something called a solo practice, where there's one doctor. In 2017, 51% of dentists in the U.S. were in solo practice. That's just over half. Comparatively, in 1999, this was almost 2/3 or 65%. So the face of dentistry really is changing. Now, dental care is moving towards group practices and even hospital-based dentistry. This is something we'll kind of get into detail a little bit later. But first, who are the members of the dental team? Well, on any trip to the dental office, you might encounter a combination of the following: a dentist, whether general or specialty dentist, a dental therapist, a dental hygienist, a dental assistant, possibly a nurse, a receptionist, an office manager, maybe a billing specialist, and in some cases, a dental lab technician, though usually they are employed at a dental lab itself. So let's review general dentistry and the 11 recognized dental specialties. That's a lot. So first, what is a dentist? A dentist is someone who obtains a degree after at least 3, usually 4, years of undergraduate training and typically 4 years of postgraduate study, similar to medical school. Licenses are provided by individual states. As we talked about, a dentist focuses on the head, the neck, and diseases and conditions associated with those. In 2018, there were almost 200,000 dentists practicing in the United States. So dentists and their varying subspecialties as defined by the American Dental Association. First, general dentist, which is not a subspecialty, but I'm including it here just so you can see the full list. A pediatric dentist, a periodontist, endodontist, prosthodontist, orthodontist, oral surgeon, oral pathologist, oral radiologist, a public health dentist, a dental anesthesiologist, and an oral medicine specialist. 1 in 5 dentists in the United States are a part of one of these clinical subspecialties, not including general dentistry. So what is an endodontist? Well, endodontists focus on the pulp of teeth. If you've heard of a root canal, endodontists are specialists of things like root canals and root surgeries. What is a periodontist? Periodontists focus on diseases associated with the the gums and supporting structures of the teeth. Oral pathologists focus on the pathology underlying oral diseases and conditions. They help to diagnose more difficult cases of things that might be happening within the oral environment. An oral radiologist, rather than focusing on just the pathological side, they focus on the radiological images and x-rays. They interpret tougher x-rays, things like that, to also help with, in some cases, more difficult diagnoses and conditions of the head, the neck, and the jaw. Pediatric dentists focus on seeing children and sometimes even children and adults with special needs. They provide both primary and comprehensive care, so they are primary dental providers. Orthodontists focus on occlusion and the correct bite. They focus on the jaws and things like braces. If you've heard of braces or even clear aligners, orthodontists specialize in fixing the occlusion or the bite of teeth. Oral surgeons focus on surgery. They focus on removing teeth, placing implants, possibly grafting jaws in place, things like that are a little more complex and out of the scope of a general dentist practitioner. Dental anesthesiologists focus on pain management and anesthesiology during dental procedures. Prosthodontists focus on more difficult cases of restoring the dentition and multiple missing teeth, things like partial dentures and implants, and changing bites with appliances. That falls within the scope of a prosthodontist. A public health dentist focus more on the community versus the individual. It's the science and art of preventing and controlling dental disease through a community effort. So they're very important. And lastly, oral medicine, which was more recently added, I believe, of March of 2020. And this focuses on the diagnosis and management of mouth sores and taste change, dry mouth, burning sensation with the jaw and facial pain. More complex issues can be handled by an oral medicine specialist. So wait a minute, 11? This is a lot of dental specialties in addition to a general dentist. So how do I know if I need one? Well, your primary dentist, a general dentist, or typically a pediatric dentist, if you're a child, will provide a referral. So don't worry, you don't need to memorize these. It's a long list and very complex. So what are some other areas in which dentists may focus? Well, geriatrics, older adults, nutrition, oral cancer, tobacco cessation, sleep medicine. Some practitioners work on things like sleep apnea and developing sleep appliances, cosmetic or aesthetic dentistry, and in some cases, holistic dentistry. So just know, while none of these are recognized specialties by the ADA, they're just areas of focus. So educate yourself about your provider and what kind of training was received. We want to make sure that you're in the best care. So let's review the team inside the office, in addition to a dentist. First, a receptionist. The receptionist helps to schedule patients, answer questions about appointments or office policies. They help to navigate insurance policies and handle billing. There's no educational requirement to be a receptionist in a dental office, but experience is really helpful. An office manager or billing specialist usually has quite a bit of background in a dental office. They handle insurance claims and more complex billing issues. They also manage office practices and intercollaboration. A dental assistant. First, we'll review unlicensed dental assistants. Unlicensed? Yes. In many states, dental assistants may work without a license with correct on-site training. However, their duties are much more limited than a licensed assistant. So they can do things like educating and communicating with patients, the basic assisting of dentists and hygienists, ensuring proper infection control and the cleanliness of rooms and instruments, etc. And also they can help with clinical charting and record keeping. Just remember, while no training is required by law for these positions, they the on-site training for them must be adequate to safely and effectively complete these tasks because they are very important. So what about a licensed dental assistant? Well, this is probably the dental professional with the most varied set of skills and duties. They can focus on obtaining radiographs, educating patients, assisting dentists, therapists, and hygienists, ensuring proper infection control, obtaining impressions for things like night guards or bleaching trays, adjusting dentures, polishing fillings, performing expanded duties in some case when they receive additional training, and even cleaning children's teeth. So licensed dental assistants require 1 to 2 years of a community or technical college training program prior to obtaining licensure, which is typically through the state. How about a dental lab technician? So dental lab technicians work typically in a separate facility than a dental office, a dental lab. They create custom fixed or removable appliances for patients such as crowns, bridges, partial dentures, occlusal guards, night guards, things like that. They may even meet with patients for things like teeth shape and shade selections. They come in all different shapes and sizes and colors, so it's very important to make sure you have a great match and a great dental lab tech working with you. So while in some bigger practices, a dental lab technician may be within the dental office itself, dental lab technicians may attend technical school, but in some cases they also receive on-site training. A registered dental hygienist. Registered dental hygienists are responsible for performing oral health examinations, providing preventative oral health services, and cleaning teeth. So collaborative agreements may be created in many states, allowing registered dental hygienists to provide care to patients without the previous assessment from a dentist. In other states, they can actually work without the dentist present in the office. So registered dental hygienists receive at least 2 years of technical training in dental hygiene, and many RDH programs offer bachelor's or even master's levels of degrees, requiring at least 4 years of training. So this is a really, really great career focusing on maintaining healthy teeth for patients and making sure they stay nice and clean. A licensed dental therapist might be a newer term for you. While many states are working on legislation to include dental therapy, only 12 states in 2019 allow dental therapists to practice. So what is a dental therapist? Well, in my home state of Minnesota, of course, we have dental therapy programs and dental therapists practicing. A dental therapist is a licensed mid-level dental professional who's able to perform preventative and restorative care for children and adults. So what can they do? They can do a lot of things that a dentist can do, like more simple fillings and things like that will basically help communities with, maybe less access to a dentist, help to get this care. So it's a really, really, really great career. A bachelor's degree in dental hygiene and additional dental therapy program, which is typically a master's degree, is typically required. This ranges from 4.5 to 6 years of total training. So it's still quite a bit of training, but it's very, very, very important. And we hope to see other states also, begin to incorporate dental therapy programs and practitioners throughout their states. So who's the dental team outside the office? Well, this may include communication with or referrals to nurses, primary care providers, PAs, NPs, MDs, physician specialists, sometimes ENT or oncology or gastroenterology, dietitians, nutritionists, speech pathologists, physical therapists, social workers, mental health therapists, and again, dental lab technicians if they are outside of the office. This is a pretty big list, so the dental team is very, very big. And just remember, it's essential in this state of patient-centered care. that's what's most important. We put the patient at the center, and we have all these different entities working together to make sure that they have the best, most well-rounded, culturally competent care. So remember, the dental team outside the office, well, this may include you, especially if you've made it this far through this lecture series. And the dental team outside the office is really essential. Remember that our dental health is really equivalent to our overall health. It's just a lens through which we can see so much. So it's really, really important to take care of not only your dental health, but also your overall health, because it is a bidirectional relationship. And prevention is key. We can't emphasize this enough. So, to review, dental care is provided in a unique setting, often separate from medical facilities and hospitals. We do see this changing. Oral health is a key component of overall health, and working together with colleagues in other fields is the best way to achieve optimal health for the patient. So, thank you to our sponsors. We'll see you next time for part 2. With any questions, just shoot us an email. Thanks so much for joining.